Hi everyone, my name is Rashilda and I've been living with a grade 2 stage 4 neuroendocrine tumor of the small intestines for a little under a year. I received my biopsy report in June 2024, and to say it's been one of the harder years of my life would be an understatement, but nevertheless I'm still here thriving, and I'm going to share just a small portion of my story with you all today. In terms of navigating treatment decisions, when I found out this was a neuroendocrine tumor and that this was cancer, my thinking was that I wanted the very best working on me. So I got online and I was able to find a database of all the doctors in the country that specialized in neuroendocrine tumors. And I found a surgeon that I liked on that database. I saw her patient reviews. They were all so amazing. So I made my way. I called up Cedars. I would like to schedule an appointment with Dr. Alexandra Ganji. Of course, I can't just call Cedar Sinai and get myself scheduled with a surgical oncologist right away. But they were able to schedule me with an oncologist. And after he did his preliminary workup, the first thing out of his mouth was, I'm going to send you to Dr. Alexandra Ganji. And I was thinking, perfect, because that's exactly who I came here for. And I made my way over to Dr. Ganji. And when I saw her, I think I knew I had made the right decision for me. I've been in healthcare since 2007, and she knew this. Yet she still sat down with me on that first interaction. She drew on her little notepad exactly where my tumor was in conjunction with the rest of my main organs. And then she told me exactly what she was going to do in that procedure to remove that tumor. So I made the decision right then and there to have Dr. Alexandra Ganji perform my surgery. I was very comfortable with her. Her bedside manner was excellent, and she had spent so much time with me in that first visit. I believe more time, probably double the amount of time that I had with all three of the visits I had with the surgeon I saw from the other place cumulatively. She just took her time and explained everything to me, and I feel like that was important. So, in terms of navigating treatment decisions, definitely getting a second opinion and feeling comfortable with the providers that you have. I cannot stress this enough, and I cannot reinforce this. I also realized the decision to see Dr. Ganji was the best one when she recommended the Neuroendocrine Cancer Foundation group to me. And this group has been a wealth of knowledge. Full transparency, in February when I was asked to do this video, I kind of had a bit of a moral dilemma because I did not feel like I was thriving with a neuroendocrine tumor. I felt like I was barely surviving. It was February and I had my first scan in December. The radiology report had some things I did not want to see, and I just became very depressed. So at that time, I was working my way out of that depressive episode. I had restarted therapy and I restarted going to the group just so I could find a way to manage my next scan appropriately. And to say the group has been an amazing wealth of information would be an understatement. The group has been so helpful to me in terms of the specialists that you see and the treatment, learning about all the different treatments that all the different people in that group are experiencing, and also learning from people who've had many more years with this disease how to manage any scans or how to manage any anxiety or depressive episodes I may have was also significantly helpful. There is no book on how to live and thrive with cancer, but I honestly can say the group has been the closest thing for me to that guide with living with this disease. So I think getting a second opinion is important. Finding a provider that you trust, finding a provider that you're comfortable with, and then most importantly, learning what thriving means to me. And I guess I realized that unlike many other people with different forms of cancer, I still work. I still do all the things that I used to do before the diagnosis. So while I do have this disease and it's been a mental struggle, physically I am still able to do all the things that I love doing. And I just decided to make kind of a bucket list of all the things I've wanted to do. And then I've also made the intention of living day to day, not worrying and not stressing and not harping on the things I have no control over. So I'm working my way slowly through that bucket list. I'm seeing all the concerts I want to see. And most importantly, I'm scheduling all those trips I want to take and spending all the time I can with my loved ones, ensuring I'm not doing anything that doesn't spark or bring me joy. And if it's not something I don't want to do, I'm not going to force myself to do it. Just living intentionally and staying present with where I am has been helpful in helping me cope with this disease.